I work at Dasra, a Mumbai-based non-profit that works to build collaboration between stakeholders in the Indian development sector to catalyze social impact. And currently, I lead our effort to anchor and facilitate a coalition that aims to bring 1 million young Indians together to amplify their voices for improved access to family planning as a critical pillar to improved quality of life. This coalition is called Youth Ke Bol, which translated directly means the voice of the youth. And we're proud to be facilitating this effort with our partners, Yuva, Restless Development, and UNICEF Yuva, some of whom are here today. We are in the early stages of building this coalition so far, and today's session is an effort to share some of our learnings and our journey so far, and talk about why we feel strongly about centering young people's leadership for improved FP and SRHR outcomes, and why framing access to contraception and an overall quality of life approach is necessary to engage young people meaningfully. Before we begin, we just wanted to acknowledge a few things. We are a coalition and this is a collective effort, and we are, the partners and I that are here are representing a much wider set of young people. But as much as we try to be diverse and representative, we don't, of course, speak for all young Indians, and we acknowledge the multiplicity of perspectives that go into young Indians' access to FP and their lived realities. We also recognize our privilege. We have the opportunity to be here and represent the work, but the idea is that the coalition goes on to represent and speak for young people who have often been left out of conversations on FP and SRH. And finally, that the coalition builds on decades of long-standing work on centering young people's leadership in the conversation around FP and SRH that Indian organizations have been doing for a long time. With that, we wanted to actually start by asking the room a question, and there is a Menti poll. So if you log on to menti.com and go to this poll, you should see the question pop up. So this is the question. What are some barriers young people face in accessing family planning and SRH information? It's at the top, 51082823. And while people are logging on and putting answers, we're also happy to go around the room, and if anyone wants to share, that would also be great, if anyone would like to. I like that someone has put adults as the bag. I think we're seeing a lot of answers that are resonating: distance to service delivery, lack of space and easily available bodily knowledge, stigma, lots of things about stigma, service providers' attitude, discrimination, knowledge, dismissive providers, yeah, being undermined as young people rather than considered stakeholders, yeah, absolutely. Family restrictions, inaccessibility to youth-friendly health services, yeah. I think it's incredible to see that we have a diverse audience here from different parts of the world, but the barriers, I think, are very, they're very similar across various geographies, and certainly are ones that we see very closely in the Indian context as well. And that's really incorrect, incomplete information, absence of emotional help. Yeah, anyone would like to elaborate or share more. Okay, then we can move ahead.
So, the gentleman.
Oh, there is. Oh, please. Go ahead.
Here's just one comment. To me, I think the lack of information is the key. If the youth are well equipped with knowledge and the information about the SR services, I think it can transform their lives. So I think that is the key to it.
Yeah, absolutely. I do think that access to credible information, particularly youth-friendly information, certainly is, I think, one of the greatest enablers. But, yeah, please.
Okay. In addition to access to information, I feel like the policy environment is also not favoring.
Yeah.
In some countries, we've set up artificial age restrictions for access to commodities like family planning commodities. Why are we even calling them family planning when I'm not trying to plan a family?
Absolutely.
Why not? Why can't we change it from International Conference on Family Planning to International Conference on Contraceptives? So I feel the policy and legal environment is not enabling in that I had a very good point to say, but I forgot. I remembered.
Yes.
Why are we calling for youth-friendly spaces when we can have a youth-friendly health system?
Yeah.
I feel our sexual and reproductive health rights needs go beyond just the space in a facility. It goes beyond that, and because it goes beyond that, and I don't know the statistics of youths in India, but I come from Zambia, and over 82% of our population are young people below the age 35.
Yeah.
So if we are going to cry for a youth-friendly space, it is not enough. Why then can't we just advocate for a youth-friendly health system? Or for the purpose of debate and accommodating everybody, why can't we talk about an inclusive health system?
Absolutely. Absolutely. I think we resonate so much with that, and you hear us talk quite a lot about moving young people's access to contraception out of the silo of just family planning that's often keeping a number of young people out. So thank you for sharing that. To just quickly go on, right? So I just wanted to...
Sorry, if we can just check if it's okay for people to be recorded.
Sure, yes. We are live streaming this on our social media handles a little bit. Is everyone okay with being recorded? Great. And you can follow us at Dasra India on Instagram. Shameless plug there. Okay. We wanted to start by framing the problem before I hand over to my colleagues on the panel today. So really, there's a lot that you hear about the unrealized potential of India's demographic dividend and how they hold the key to India achieving SDGs and really improving overall social development goals, right? But when it comes to young people's health, particularly in their sexual and reproductive health, we see that access to contraception is holding this population back, young women in particular, right? So the current National Family Health Survey, NFHS5 results have shown promising shifts in the total fertility rate coming down, in more uptake of contraception, in decrease in child marriage and teenage pregnancy. But there still remain, I think, some troubling statistics right now. So in an effort to discourage child marriage, the state has recently increased the age of marriage to 21. But what the survey reveals is 61% of women aged 20 to 24 were already married by 21. Showcasing that I think child marriage remains a critical, a prevalent sort of cultural norm that continues to exist. And, pregnancy always sort of follows closely on the heels of early marriage. And 53% of currently married women between the ages of 15 and 19 have begun childbearing. But what's really, I think, the crux of the problem that we're trying to solve is that we see most of those women don't want to see those pregnancies to term or don't want to have babies in the first place. We heard yesterday the UNFPA representative talk about how currently we're at 121 million unwanted pregnancies globally, and 1 in 7 of those are in India. and 17.4% of young women in the 15 to 24 age bracket currently have an unmet need for family planning, especially modern contraceptive methods, right? Really showcasing the urgent need to focus on that population and close this gap in particular. But more than just health outcomes, when it comes to young people, access to contraception is much more than just improving physical and mental health. It's a lot more about their ability to secure futures, enter careers of their choice and stay in them, complete secondary education, navigate and have consensual, loving relationships, explore their bodily autonomy, sexual pleasure, etc. And you see that even in the data that's coming out, right? The national survey shows that 66.3% of employed women use modern contraceptive methods compared to only 53.4% of unemployed women, clearly showing a link between access to contraception and your ability to really achieve economic aspirations as well. There's a tremendous opportunity that we have here. If we were to close the gap and meet the unmet need currently of modern contraceptive methods in India, we would have 732,000 fewer unintended pregnancies and 482,000 fewer unsafe abortions, which is a humongous number that we would then, really be empowering young women who then are going to take sort of social development goals in India forward. So it's really kind of a critical population there. Of course, there are a number of interventions that are currently happening in India, particularly ones that the state is championing to ensure that we're addressing these gaps. These are some of the most prevalent ones right now. Mission Parivar Vikas, which focuses on family planning for new and young married couples, particularly in high fertility districts. Under the Ayushman Bharat, which is a central government scheme, the government is using the school channels to get SRH information and services to young people, and also ensuring that primary health centers are where adolescent-friendly sexual reproductive health information and services are available to young people in their communities. And particularly the RKSK, which is Rashtriya Kishore Swasthya Karyakram, which basically means health for the National Adolescent Health Scheme. It essentially is India is one of the first countries to have a concerted RMNCH strategy and a scheme specifically focused on comprehensive adolescent health. And this particular scheme is one of the most critical ways in which services are delivered to young people, information reaches them, right? But really, there are critical gaps that still need addressing when we talk about young people's access to contraception. Number one is what she just said, which is there currently is a very siloed, sanitized, technical narrative around family planning. And most young people are asking the question, if I'm not planning to have a family, why do I need contraceptive access? So moving access to contraception outside of family planning is particularly important, so that we're able to frame it in young people's lived realities, their everyday lives of school and going to work and relationships and friends and wanting to travel and plan for your future. The second is that because of the fact that it's often framed as family planning, it's often catered to married people, married young people, because it's in the context of planning for families. The systems and interventions are currently leaving out a number of young people, particularly unmarried young people, and in particular unmarried young women who face tremendous stigma in accessing contraceptive services, and then even young people from the queer community, trans community, young people with disabilities who are all left out. The third is that while it is obviously really important to focus on family planning and contraceptive services with a lens of gender equity, there is often this narrative that only focuses on young women as the core stakeholders, right? But interventions need to be intentionally engaging men and boys as well, so that they're actively sharing the burden of contraception. They are equal stakeholders and allies and champions as well. And finally, the thing that really underscores everything that we're doing is that young people's voices, their solutions, their leadership, and their choice needs to be central to the way in which programs are delivered, central to the way in which the government and the systems respond to the needs of young people. And that really is why we are focusing so much on a leadership-focused approach, as well as a quality of life approach when it comes to improving contraceptive services for young people. With that, I wanted to hand over to Sharan. Sharan currently is a campaigns lead at Yuva. a youth-oriented media and data insights company where she forefronts all campaigns and projects with Yuva's non-profit partners, with a focus on building safe spaces for youth engagement and empowerment. Yuva is our communications partner in our effort to build this coalition, and is leading a lot of our narrative change campaign work as well. Sharan, I wanted to ask you, can you talk us through what really is Youth Ke Bol? What is this coalition? What are we trying to solve?
Thank you so much, Aditi, for that introduction and for also laying down the context and the current landscape of young people's participation in family planning in the Indian context. Before I start, I just want to address and thank you so much for sharing the need for reframing the whole language of family planning versus contraception. Very funny thing. When I was coming for this conference, and I told my friends, and they're like, why are you going? You don't even have a family. Like, I'm not even married. So I think I totally resonate, like that really resonates with us, and we really, and thank you for saying that. Anyway, so given the current scenario of family planning, access and availability in India, there was a strong need to create an enabling environment where young people can take leadership to amplify their own voices and effect change within their communities, while also at the same time advocate their needs directly with decision makers. As we spoke to more and more young people about how we can meet them where they are, they sort of presented an urging opportunity where young people can engage with their peers and move towards collective action. Keeping these learnings and of course the findings that we're seeing here in mind, Dasra, along with partners at Restless Development, UNICEF and Yuva, has been undertaking the work of building a diverse and representative coalition of young Indians. So this youth-led coalition is bringing together young people aged 18 to 29 from across India, from tier 2 and tier 3 cities across the country, with the aim of strengthening their access to contraception, sexual and reproductive health care services and knowledge, and family planning as critical pillars to their overall improved quality of life. More importantly, why? Because we want young people to, fulfill their aspirations and live up to their full potential, and hence the quality of life approach. The coalition aims to amplify the voice of youth ke bol, so directly amplify what young people are saying and what they feel, and have a collective young voice, and create ways for them to directly engage with policymakers and private sector stakeholders, as well as also encourage advancement that can, like we're seeing here, encourage advancement that can meet and respond to the unmet need of family planning in India. Through this coalition, Youth Ke Bol, we are hoping that young people can sort of mainstream the critical linkages between fulfillment of their aspirations and their agency to make better and more informed life choices with sexual and reproductive healthcare access and knowledge. Dasra and our partners are supporting the coalition in its initial phase till 2024. And eventually the aim is to create a self-sustaining youth-led community in partnership with other youth-facing organizations. I would like to speak on how Youth Ke Bol is addressing young people's need to advance contraceptive and SRHR access. Firstly, we are engaging a cohort of 15,000 young ambassadors through capacity building and leadership support to equip them so they can lead policy, media and community engagements within their networks. Secondly, we are deploying a digital and on-ground engagement model to reach 1 million young people across the country and hear from them directly. To also understand what are the challenges, what are the solutions, what are the priorities we need to focus, while at the same time, which is at the heart of what we do, is amplify their voices and hear from them. Thirdly, we are creating an institutional framework and forum where young people can have the opportunity to have regular sort of interface with policymakers, government stakeholders and ministers, to provide regular and in-time regular feedback and input, so that can define and go into shaping the policy landscape in the Indian context. And fourthly and very importantly, and that's what actually we do at Yoga, is we're leading narrative change campaigns that can place access to contraception as a cornerstone for young people's improved quality of life, and which further links to not just gender equity, empowerment, equality, but also like safety and resilience of young people overall. All of these four approaches are rooted into core fundamentals. First being that we believe building leadership of young people so that they can not just engage with the communities but also engage with stakeholders and policymakers. And second is shifting the narrative through building holistic, youth-centric and participatory campaigns. Through our various consultations with young people in the last many months and years, we believe there is immense potential and power in building campaigns that can shift the narrative and enable young people's access to not just contraception but also enhance their agency to make decisions and take actions. Like Aditi was also mentioning, the current narrative on family planning is leaving out a lot of young people, especially unmarried couples and young men and boys. And more so because the existing landscape, especially in India, the SRHR discourse is very female focused, sanitized biological discourse. And what we are also seeing, and personally also from our experience of working with young people, we're seeing that there's still a lot of stigma, taboo and hesitancy among young people to sort of be open about these conversations and also find a safe platform for them to not just have dialogues amongst themselves but also have dialogues with policymakers and other private sector stakeholders. Keeping these insights in mind, and that being said, I would like to just go through what our journey has been so far, and starting with, so we've led multiple activities spearheaded by young people, and we've also been gathering insights from the youth over the last 1 year in many phases. And this has critically defined many of the coalition's outputs with young people's active input and participation. We conducted 3 focused consultations with young people, youth-focused organizations, CSOs and experts to understand the landscape and also co-create approaches and at the same time validate these outcomes. This sort of truly helped us in just focusing on what avenues to focus on and sort of streamlining our core narratives and coalition's themes. Secondly, we at the core of the coalition we have and we've been seeking advice and input from our youth advisory group, which consists of 12 leaders from 8 different Indian states. In fact, one of our youth advisory group member, Vaibhav, is on the panel with us today, and you'll be hearing from him soon. This youth advisory group launched the Youth Ke Bol Coalition in partnership with the Ministry of Health and Family Welfare on World Contraception Day on 26th of September. The coalition has built an active partnership with the Ministry of Health, where young people are also getting to directly interface with government representatives and ministers. In fact, the recent consultations and data and insights that we received as part of that phase have gone into, have been presented by the YAG, which is the Youth Advisory Group, to the Ministry, which has gone into feeding and firming up the FP 2030 agenda, which is, I think, a great milestone to begin with in the first year. And this is something which is very close to my heart. We have ensured that there is brand recall and relatability of the coalition to young people, and so young people can also identify with this whole collision. So we have engaged them in the process, and young people have sort of defined and helped us in envisioning the collision's identity. In terms of the branding design, the logo development, and also like defining the whole tonality of this collision of Youth Ke Bol. And I think this has been a key sort of learning also for us, where it's been a very, very participatory approach. And as part of this process, we surveyed over 10,000 young people who have assisted with birthing this collision and bringing its identity to life. We have also been building social media and digital engagement activities to link young people's access to contraception and family planning with an enhanced quality of life lens. Since the launch, we've been posting consistently on Josh, which is like TikTok's Indian sister, and a platform very, very relevant to our young tier 2 and tier 3 audiences, of course, in addition to Twitter and Instagram. And we're also gearing up for very specific and targeted campaigns in the coming months. Our first campaign, which is centered around young men and boys, will be launched in December, and we're all working towards it. I'm also pleased to share that the Youth Ke Bol collision, it says 55, but right now it's over 62,000 young people actively engaged. Yeah, that is a very celebratory moment. Engaged on digital channels, and I feel you, Veda. And over 350 young leaders meaningfully engaged on ground across 6 state chapters, and Harshita will be speaking more about it. Actually, it feels great to say that out loud, and we've never said it out loud actually. So it's a great milestone for all of us. Thank you so much. And it's a long road ahead of us, and we're on this journey, and we're very excited to see where we land and what we can achieve working together with young people. Coming back to this panel, over the next few minutes, we will be sharing the pathways that the collision is deploying to meaningfully engage young leaders in family planning, and also share some insights on what we are hearing directly from them. Today's panel and presentations will focus on 3 major agendas. Harshita will throw some light on why a collective approach like collision building is imperative in building sustainable leadership of young people, so that they can lead change within their communities and at the grassroots. Secondly, Vaibhav, our youth advisory group member, will speak on the implications of sexual reproductive health and family planning on young persons' overall quality of life, and he brings a lot of lived experience to this panel and to the collision overall. And finally, Ada will elaborate on the need for building ways for young people to interface with policymakers and decision makers, and the impact it has not just on the youth but their communities and the health system at large. And with that, I would like to hand it over to Aditi so we can hear from our awesome panelists. Thank you.
Thank you, Sharan. And thank you for sharing a snapshot of the journey so far. I'd now like to invite Harshita Thapa from Restless Development. Harshita currently is working as a program officer in the Jharkhand chapter of Restless Development India, where she manages a portfolio of programs supporting child rights and youth leadership. At Restless, she enables better team management, works with the government and key stakeholders on nurturing coalitions, leadership building of young people, reporting, and advocacy as well. Harshita, we'd like for you to tell us a little bit about why is it important for youth leadership to be at the center of improving SRHR outcomes, and why and what are the advantages of a collective coalition building?
Thank you, Aditi, for a wonderful introduction. So, as stated by my colleagues, we represent non-profit youth-led agencies which work with young people to demand and deliver a just and sustainable world for all. I have been representing Restless Development, which is a non-profit global agency that supports the collective power of young leaders to create a better world since 1985. I am excited to represent this partnership because we at Restless Development believe in the power of youth leadership. So, why the youth, you might ask? The common problem is that development practitioners tend to view young people as beneficiaries and targets, a problem that needs to be solved. However, with 50% of the world population under 30, we should engage young people as partners and agents of change. The ability to effectively engage the peak youth generation, the largest ever global population, and allow them space and opportunities to lead collaboratively in development represents a historic opportunity to bring about transformative change on a global scale. Often the community agency is ignored and the young people's latent potential is neglected. We must not leave the future of our youth to the realm of chance. A failure to support, engage and work alongside this generation of young people who are ready to do things differently would simply mean that this opportunity is missed. In order to ensure that this does not happen, we need a youth-led coalition to tackle social problems. SRH and FP in particular, and I advocate for a youth-led coalition for the same. Our organizations, through our various programs, have had first-hand experience of the effectiveness of youth leadership building and what happens when they are equipped and able to collectively advocate for themselves and their communities. Now back to the question we sought to answer. To successfully close the gap of unmet need for family planning, young people need to be involved and engaged in delivering programs that respond directly to their needs, forming networks and partnerships, acting as mobilizers and influencing parents, communities and national government. To begin, the experience of organizations such as Restless Development and Dasra shows that young leaders, once adequately equipped with knowledge and skills, can be effective change makers and participate in dialogue with their communities and peers on issues that affect them directly. The younger generation is more connected, tech savvy and civically active. Traditionally, community agency, both of individuals and of community organizations, has been largely overlooked and deprioritized by development practitioners. This is an even bigger pitfall considering the increased capability of the youth in this tech age. Thus, equipping the youth with knowledge and skills is essential. Also, there is a need of transfer of power, resources and ownership to youth organizations. This cannot be used as a part of capacity assessment to identify where youth sit within an organization and to identify future ambitions. Evidence from our program called Girls Not Brides work affirms that building active leadership among young girls has led to gender responsive budgeting and local governments integrating youth-inspired activities into their work plan. The transformative change that youth leadership has created across their work has catalyzed long-term sustainable change at the community, state and national levels. Secondly, from our experience and that of our partner organizations, we have learned that if you build leadership, choice and agency among young people, they move from being passive recipients of services and information that are delivered to them into the role of innovative and unique solutions that are most relevant to their specific and hyper-local contexts. In the view of the same, we have created the power shifting checklist to guide the work that we do and ensure all young people have the power to lead change, opportunities to build confidence, networks and skills enabling them to learn, adapt, grow and ultimately thrive. These checklists include prioritizing youth leadership, their safety and happiness. In a nutshell, we intentionally shift power so that young people recognize intersectionality and their uniqueness. We let communities lead their own development so that we can capacitate holistic leaders to deliver their own futures. What we observed is that young people quickly change their behavior or mobilize action in their communities to respond to long-standing challenges such as child marriage or gender-based violence, as well as more pressing emergencies such as disease outbreaks or climate-related disasters. With proper support, they become strong advocates and hold decision makers to account. Now coming to the other question and the more pressing one. Why do we need youth leadership in family planning? There is no doubt that one of the key components of family planning is the ability to make choices. And youth leadership plays an explicit role in empowering an individual to exercise their right to choose. Youth leadership is essential to creating agents of change who are in turn essential to successful family planning. And this requires a transformation of adolescent and youth programs from a field for young people to the one with young people. A study called Understanding the Lives of Adolescents and Young Adults was conducted in Bihar and Uttar Pradesh states of India with an aim to measure the quality of transitions to young adulthood experienced by adolescents. Confirmed that large portions of adolescents would feel shy to approach a healthcare provider or pharmacy or medical shop for contraceptive supplies. Additionally, the study shows that only 21% of married older girls and 44% of younger girls are allowed to visit selected locations unescorted. On the other hand, in a multi-component program called African Youth Alliance, we found girls exposed to AYA were at least 13 percentage points more likely to report using a condom or contraception and 10 percentage points more likely to report using condoms or contraceptives consistently. While the interpretation of both these studies is subjective, it is obvious that a sense of agency and mobility is essential for the youth. Given that lack of agency and the inability to make informed choices about their bodies are significant barriers holding back vulnerable young people from realizing their aspirations. Therefore, focusing on building youth leadership can help them articulate and negotiate decision making. In another one of our success stories, Restless Development, supported by Bill and Melinda Gates Foundation, successfully completed a 3-year program on youth-led accountability for SDG 5 and FP 2020 in India and Tanzania. Under this initiative, we capacitated and trained 56 young people known as Youth Accountability Advocates on concepts of gender and SRHR through a detailed accountability action toolkit. These young people engaged 375 young change makers to execute action plans. They gathered data from 5,675 people to inform and legitimize dozens of campaigns and actions aimed to influence local and district decision makers. The efforts were amplified through numerous global level coalitions, which resulted in direct actions by government and local service providers. In order to equip young leaders to be confident, constructive, and compelling in equitable dialogue with decision makers, it is necessary not just to build their capacities on thematic and skill-specific areas. It is equally, if not more, important to deploy a networking and leadership building approach through which young people can find safe spaces among their peers, collectivize and network at local and national level to share ideas and knowledge and influence change within and outside their communities. Having networks can help them navigate difficult situations and increase the chances of uptake of services and programs. Through our approach to building youth leadership in family planning, we hope not only to foster an environment where young people feel empowered to navigate personal and community level challenges, but are also part of conversations where solutions are designed and have their rightful seat at the table. Furthermore, it is important that the learnings accumulated, more so in the regional context, are spread and sustained. In this way, leaders of the future will be better positioned to advance the cause. Our organizations have been doing so by the means of youth civil societies, which is a diverse and innovative network of youth groups, organizations and networks. We host the Youth Collective, a global community for youth-led organizations. The collective provides peer-to-peer support, learning and opportunities. With the help of a coalition of youth leaders, these leaders can navigate these challenges together and in doing so create peer networks that make access to SRHR information credible. We have done so for Girls Not Brides discussed before, wherein we help create a network of state-based chapters where young people work with their peers, communities and local decision makers to affect narrative change and engage people online. We are also advocating for cross-border collaborations to bring the voices of young people together as part of a youth collective. We have been working with youth coalitions for the past few decades, and while I made the case for youth-led coalitions, we need to be mindful of a few pointers. Sustainability is an important aspect of any coalition, especially in diverse coalitions. As shared earlier, it can be done through initiatives such as the Youth Collective. Such initiatives will ensure that the youth have the means and resources to combat situations that might lead to fragmentation or alienation. Coalitions usually have a difficult time maintaining a balance between a single simplified agenda and a broader representative perspective. In this regard, it is imperative that the coalition is steadfast in its agenda, but also that the agenda itself makes provision for a diversity of viewpoints. Even the seemingly strongest coalitions might implode without ensuring the same. In order to be true representative, there is a need to be intentional recruitment activities so that the coalition does not simply present the dominant viewpoint of the coalition members. Finally, the development of strong governance mechanisms and accountability mechanisms, as well as cultivating the support of other key stakeholders, is crucial if a project is to achieve its goals. Finally, there is also a need to be evaluated regularly in order to ensure the focus remains on the project's objective during its course. With this, I rest my case with the hope that I was able to convey our story and the need for a youth-led coalition around access to SRH and family planning. Thank you all for being patient listeners. Nothing about us without us. So,
Thank you, Harshita. I wanted to stay on the slide for a minute to re-ask the room this, right? So, we're in the process of building this coalition, and I know many of you use sort of collective approaches here. And I'd love to hear if anyone in the room would like to share some of their learnings and challenges in building these collectives, right? Because I think the aim definitely is to bring together multiple perspectives, but there's sort of a tough balance to maintain, particularly in our context where we're also trying to work with the government and ensure that we're in partnership with existing sort of schemes, etc., on how we balance what young people want, which is obviously the core, with sort of having a very fragmented approach. I think coalitions end up losing steam if you try to bring in too many people and it has too many sort of agendas at the same time. But that sort of is the point of a coalition also, to bring them together. So I'd love to hear if anyone would like to share experiences, either successes, things that have worked, but also things that haven't worked in building these in sort of collective efforts, if you would be willing to share. Yes. Can I hand the mic? There. Thank you.
Good morning, everyone. My name is Brian Pande from ESO Zambia. One thing I would like to share, which is quite similar to this, has been our works which we have been doing, especially through the Make Way program, where we are working with young people in various areas, various regions. Of course, in issues of sexual and reproductive health. And we are working as a consortium of organizations, that is the Make Way. Similar to the works that you've mentioned, that you've highlighted. Of course, we're bringing our different ideas together and we are working with different stakeholders, including the government. But I think one thing I also I noticed is that in as much as you are engaging the government, different stakeholders, see, there's a tendency of separating young people from the adults. What we've been pushing is an agenda of identifying young people as stakeholders. What we say is, do not look at me as a young person. If you say I'm a young person, it will always make you see me differently. If you say I'm younger, I need to be empowered, this and that. See me as a stakeholder, first and foremost. See me as a stakeholder. So we've been even training, as we are engaging the different stakeholders, the parliamentarians, talk of the ministry itself, Ministry of Health in Zambia, as well as the duty bearers, especially in the Ministry of Health. We always try to train them in meaningful youth engagement so that they understand to say, if you engage young people first and foremost, see them for who they are, stakeholders.
Yes.
When they come to a hospital, see them for who they are, clients. Don't look at them and say, young people first and foremost. So we've been taking that approach also, trying to ensure that meaningful youth engagement is there by seeing young people as stakeholders and not as young people first. So maybe that's one thing I've not seen there. That's something you might need to also consider in our works, in your works. That's what we are doing, and maybe that's something we could all try to push for also. So as we are engaging them, as we are engaging the different stakeholders, the policy makers, the idea is they should also understand to say they should see young people as stakeholders first.
Yes.
Thank you.
Thank you for sharing. I think that's an excellent point. Sometimes the language that we use tends to other young people to begin with, and seeing them as equal stakeholders. Thank you. Would anyone else? Oh, yes.
Oh, wow.
Oh, there was a different order. Oh. I think, you're the gentleman. Right there. Thank you.
Thank you. My name is Simon Sikwese from Malawi. Thank you very much. I think this has been very creative. Just in addition to what my colleague or cousin in Zambia said, one of these things that we're struggling with in a more similar project is how healthcare workers will look at the young people as partners who are going to sort of help in task shifting, where if they become part and parcel of the service delivery system, we're talking about self-care packages, where young people can, among themselves, be administering those services that they can control, the pills, etc. But now to get that buy-in from the healthcare workers, I think there's still those issues of attitudes.
Yeah.
These are young people, they cannot.
Yeah.
And I would like to agree more that we really need to support young people to make sure that we push for the engagement so that they are being seen as partners in making sure that they're accessing the right services. And how to do that is something that we're struggling with, because we still need to look at how do we change those attitudes of the healthcare workers who still are thinking like parents.
Yeah.
These are children, they cannot. But if you look at young people, there's a lot of potential, but we're not providing the much needed support so that we work with them as partners, as he said, so that now they're able to help in make sure that we are decongesting the healthcare facilities, addressing the issue of accessing services, but make sure that those services that they can access, they must be made available to young people.
Yeah.
Malawi faces very difficult situations where there are places where young people have to travel maybe 20 kilometers just to access a condom. And yet they are there to work with the healthcare workers, where if we can find a space where they can keep those commodities, they can be distributing to the young people, and young people can be accessing the services. And we're failing to do that because we're still underrating the capacity of young people. So I think this has been a very great learning point, and I'm looking forward to how we're going to sort of improve the programming of one of the projects that we're working in 2 districts in Malawi to make sure that young people are accessing the basic commodities that they can easily access, but I think healthcare workers still cling to those circumstances, yet there's so much that they need to do, but they can sort of transfer those skills to the young people. So thank you very much, and
Thank you.
so much.
Thank
I think
you.
there were two speakers there. 1, 2, and 3.
Yeah, can we, sorry, in the interest of time, take one speaker and then hear from... No.
Maybe we can hear all 3
Okay.
and then we won't answer. Sorry, we'll answer it all together.
Yeah, but people are just
Yeah.
Okay, go ahead.
Thank you so much. My name is Abhinav and I'm representing the YP Foundation from India. So basically, I've heard a lot of we are you people are also building the capacities of young people through the network and also trying to engage with the policy makers and decision makers at different levels. So we are, as an organization, we are also supporting one network which is known as STEPS, which is basically stepping towards enhancing policy structures. But I also wanted to understand, because they have, personally we are also facing some issues, some challenges in which when we are trying to engage young people with the decision makers, although we have a buy-in from the Ministry of Health and Family Welfare for the network for our work in building the capacities of young people. But when it comes to engaging with the policymakers, sometimes it becomes very difficult because there is no institutionalized or mandated spaces within the government structures where young people can directly participate and engage with them.
Absolutely.
So is there any kind of any strategy that you are also adopting in your coalition building, where we are also advocating for these spaces within the government structure, within the policy implementation structures, and then we can try to engage better at different levels? Because I also in the email presentation, you also mentioned about Ayushman Bharat, the school health program, the RKSP program. The school health program anyway is a joint venture from Ministry of Education and Ministry of Health and Family Welfare. But when it comes to the implementation of it, it's interministerial, interdepartmental coordination is very lacking in the implementation of that. So do you have any kind of an insight to it? So it would be great and also helpful for me.
Thanks. Thank you. And I think when we go back to the panel, you hear Aga talk a little bit more about how we are looking at building the institutional kind of space. Because you're absolutely right that without something regular and mandated, the hearing from young people is quite ad hoc, right? And it continues to perpetuate the divide. Thank you. I think we had one more person.
The 2 more.
Two people, sorry.
Hi. I'm currently working with the Dutch Ministry of Foreign Affairs, and I'm interested to hear if you could reflect a bit on what we see as a donor is that often when you work in coalitions and in partnerships, there's a bit of a competition. So if you as a donor, you want to give a certain pot of money to obtain an objective, and whether it's with youth or adults, you have competition between organizations. And I'm very curious to hear whether there's a difference according to you when you're young people, when you say, okay, we want to move forward, whether that competition element is less present amongst your coalition than when you work with adults, or more adults, how you say it, not adult, but older people organizations, whether there's a difference there. Because I'm very interested to hear on whether the flexibility of and the common interest and the drive that young people might have more in their togetherness takes away a bit of the competition.
I think that's a great point, and maybe we can just come back to it at the end to answer. But I think there are a couple of things that we've been doing in sort of building local leadership as well that we're thinking of. But yes, please.
Hi. Good morning, I'm Donna. I'm from the Philippines. And right now we are pilot testing a very youth leader-centric program. It's called the Youth Leadership and Governance Program. Actually, I have with me one of our youth champions who is an elected youth leader. In the Philippines, we recognize the potential of the elected youth leaders in terms of executing programs and legislating ordinances. And from 2019 to present, these youth leaders who are playing both the executive and the legislative role were able to implement ASRHR reforms in their respective local government units. And we recognize that the critical role of the elected youth leaders in the Philippines is really creating a safe space both for adolescents and youth, especially in ASRH. Because in the Philippines, we do not recognize that ASRH is a right. In fact, most of the our partner municipalities that are 100% Muslim communities, the parents do not know that they have the rights to decide that they have the rights to say no to arranged marriage. And our youth leaders were able to legislate reforms and co-create AS managers to listen to interventions. Maybe Ella can share as well her experiences.
Is it okay? Is it okay if we do it a little bit at the end? I do want, because some of the questions and the points that have been made, I think both Vaibhav and Ada are going to talk a little bit more about, from their experience as youth leaders as well. Is that okay?
Yeah.
Okay.
I will share later.
Okay, thank you, but we definitely like to hear. Okay, I wanted to hand over to Vaibhav now. Vaibhav is, like he's been introduced a few times, a member of our, he's youth advisor to the coalition, a member of the youth advisory group. He is a fourth-year law student at Dr. RML National Law University, Lucknow, and has been a Know Your Body, Know Your Rights fellow at the YP Foundation. We just heard from them a little while earlier. And he is also an incoming Unleashed Talent 2022 focused on youth solutions for SDGs. Vaibhav, can you, as a young leader and as someone who is involved in collecting insights from your peers on why young people want a quality of life approach, share a little bit of the insights of what does quality of life really mean to young people, and why is it important for us to use that framing if we were to engage more youth leaders in the conversation around access to contraception?
Thank you, Aditi, for passing the mic, both literally and figuratively. Okay, now that we have heard that building young people's leadership leads to exponential gains, I'll be talking about the implicit link between SRHR, family planning, and young people's aspirations, quality of life. In order to ensure our approach to building the coalition and meeting young people where they are, we had a series of quick pulse checks, FGDs, consultations, and surveys deployed to understand where young people are. We had two series of data sets, as was mentioned, in 2021 and 2022. In the data set for 2021, we, as 8 young people trained in design thinking and approach, collected data from 150 youth to understand SRH access, needs, behaviors and aspirations of young people across the country through a period of 5 months and 3 consultations with youth and 10 CFOs. There were 150 self-administered surveys which collected qualitative as well as quantitative data. For the 2022 data set, we had 226 youth respondents from 18 states and 55 cities. We asked them about the access to trusted information about SRH, access to spaces or platforms where they can speak to elders, officials, or decision makers about their aspirations, aspects of life that are influenced by access to SRH, and challenges they face when it comes to availability of information and services. What we heard from young people was, during both of these surveys, was firstly that young people see a clear link between access to contraception and fulfilling their aspiration. In our data set that emerged from 2022 survey, nearly 71% of our respondents said that education, 61% said their ability to pursue a career of their choice and move around for work or leisure. Over 60% of young people saw a clear link between their access to contraception and ability to access both education and employment. Thus, it emerges from our surveys that young people seem to view sexual and reproductive health access as a means to lead a better life and make choices. There's a need to therefore ensure young people feel empowered and included by society and are prepared to manage their own sexual and reproductive health needs with confidence. The second point that emerged from our data sets was that Young people want sexual and reproductive health information and interventions to be more accessible, inclusive, and approachable. While 65.1% of the women respondents and 71% of men respondents said that they had access to trusted information about SRH, still there were and there are barriers which continue to impede access to contraception. Some stats that show that are 41.1% reported lack of awareness of existing services and information. 19.1% reported lack of access due to social stigma and biases. 13.27% reported negative or biased attitudes of health workers and service providers. 11.9% reported social discrimination or marginalization, while 6.6% reported high costs. Significantly, there were higher barriers for the people who identified as non-binary. Also, more women respondents faced more barriers than men respondents for accessing contraception and SRH accessibility. For improved SRH for youth, men and boys need to be included in the dialogues, and they need to see their role in journey to healthy and positive relationships. Thus, we need to create opportunities and spaces and strengthen the existing adolescent health and family planning programs, like as Aditi had mentioned, the RKSK and school health and wellness program, so that all young people have open discussions and open dialogue. The third thing and the third observation that emerged from our data sets was that young people want increased access to spaces, opportunities, and resources where they can directly speak to the decision makers about their SRH and aspirations. 25% of our respondents said that they could speak to parents or others from members in the family and teachers or people from their educational institutions. However, what came even more surprisingly, that fewer respondents felt that they could directly speak to the healthcare professionals or openly. So what conclusively emerged that we need to work so that the young people can directly speak with the healthcare professionals and they are able to convey their needs and voices. The crux of the solution lies in access to credible information, having safe, open and stigma-free, youth-friendly spaces where youth can gather and talk about these issues openly. Then we need to have equitable spaces where youth can talk, they can share their stories and impact health outcomes, also while navigating other key issues of their life like employment, education and decisions around marriage. The four critical areas of intervention that were underscored in our data sets was A. Mandatory early sexuality education, which makes the youth feel empowered if they have the access to comprehensive sexuality education. B. Building awareness, instilling confidence to make the right trade-offs and navigating life. The youth who responded to our surveys and data sets said that their ambitions are often constrained by SRH challenges which they need to overcome and they need to be empowered to make informed decisions. C. Building youth-friendly and rights-affirming spaces for young people's evolving FP and SRH needs. The youth and the young people seek a sense of belongingness and a sense of security wherein they can share their voices in the spaces they trust and are able to make their voices heard. The fourth critical area of intervention that was underscored was engaging youth as equal partners, as was also said, in the development agenda rather than recipients of services and programs. And that youth need to be engaged in equitable conversations around family planning and SRH, which will thereby broaden the set of people who are involved in decision making. The findings from these two data sets establish a clear link between access to contraception, family planning and SRH services and improved quality of life. There emerges a strong need for family planning information and approaches to be innovative, which will thereby ensure that the needs are heard and capacities are built. Once we as young people are involved equitably as our own champions among our peers and in our communities, this leads to the narrative shifts that we are all here for. Hence, quality of life approach will bring in more inclusivity, which means that policies and programs are for everyone and not for a specific figure of population. It will bring in more sustainability and it will bring in more accessibility and open spaces, which will ensure that the voices are being heard and there is a collaborative decision making, which will again create a cycle of sustainability. Now, we have heard that what we heard from our two data sets. Now I'll be sharing what exactly, when I talk about the quality of life approach and lens, what do we mean by quality of life lens and what overarching quality of life means. So for us, quality of life lens means having access to information and having the space to make informed decisions. We as youth have the right to make mistakes.
Yes.
And the quality of life starts from there, from right to have accountability and right to have shared accountability. The quality of life lens involves agency over our bodies and realities that we come from. The quality of life lens involves fostering healthy relationships and having safe space to simply share our stories and empathize with each other and bringing these stories to the table. One might wonder what happens when access to contraception and SRH is approached with the quality of life lens. It helps in creating convergent pathways so that the roads are not running parallel and there are some common milestones to cherish while we all approach a common goal through different pathways. It ensures that we have more meaningful conversations which will lead to collaborative decision making and more inclusive and open spaces for discussion and deliberation, which will resultantly lead to enabling the choices instead of fostering the fear-based model. Thus, it will lead to more inclusivity, more accessibility and a more relevance-based approach. However, when talking about SRH and family planning from a quality of life lens, we need to be mindful that we don't represent the whole of youth. Who we represent and what we represent are our specific experience and our lived realities that we come from. We as youth have our own approach to quality of life. Different people have their own definitions of quality of life and someone might refer to as quality of life as being able to access quality education, while for someone else it might mean quality healthcare. So for someone, quality of life might mean being able to practice their religion, or for someone else, quality of life might refer to as being able to go out and have a profession of their own choice. Thus, we need to be mindful and simply understand that how diverse we all are and how diverse our all intersectionalities are. We need to be accountant of the fact of demographic dividends not being the monoliths, and the stories that are brought to the table are not mere stories, but they are the lived realities and the lived experiences. So we should not count them as mere common stories, but we should treat them as be mindful of the courage that took them to bring those stories to the table.
Yes.
There is an implicit link between the quality of life and young people's aspirations. Now, while summing up what I said, I'll probably bring in my experience whatsoever I have. So, as a young advocate for SRHR, I see a lots of discussions, as was mentioned, centered around women and young girls, which definitely is a very good indicator of years and decades of all our common advocacy and approaches. But what I see is lacking is the involvement of men and young boys and the discussions around and about LGBTQ population given the evolving jurisprudence of LGBTQ. Thus, we need to involve young men and boys in the conversation, and also we need to center and focus our discussions about and with the LGBTQ community as well. Now that the climate change is a real-time crisis we all are facing, we need to find ways on how to intertwine SRH and climate change so that both can be talked about together, which currently is lacking in most of our approaches. So we need to take care of that as well.
Sorry to interrupt, Vaibhav, just because we're running out of time. If I can request you to stop, I think that was the last of your points. But thank you for sharing that, and I think if you have some time right after this, you can chat with Vaibhav. I wanted to say a couple of just things to caveat some of the research. So, one of the things that we are seeing is that there is a lot of limited data when it comes to actually linking young people's leadership, what they want, what quality of life means to them in SRHR. And so, the study that we did was kind of a dipstick right now, done by young people, which was really important to us. So the questionnaires were designed by the youth leaders that we work with, and they were the ones who went out and actually collected some of this information. And we're hoping that with time we collect more of these regularly and use those as ways to kind of speak directly to the government, which brings us to the last speaker right now. Ada, if I can request you to talk about a little, just in short, a little bit of how and why are we so focused on building regularized channels for young people to talk to the government. Ada works at Dasra, where she leads a number of our government partnerships related work.
Okay, great. I hope this is on, or am I just loud enough? Press. Okay. Hello?
You can use that.
Okay. I think I can speak like this if this is good enough. Can everyone at the back hear me? Great.
Yeah.
Okay.
Hello.
Yeah, this is much better. Firstly, I do want to apologize. We might take a few more minutes, but I promise they've definitely saved best for last. So, so like Aditi mentioned, to culminate everything we're hearing from young people, to culminate also the approach we're using, which is basically to focus on coalition building, to focus on youth leadership building, and to actively pass the mic, we want to ensure that we are now creating a mechanism wherein which young people can directly interface with their policymakers, with their decision makers. Because at the end of the day, that is how you actively lead to scale, and you lead to interventions reaching those from the most marginalized communities as well. So how we've envisioned this within the Youth Ke Board initiative is in a few innovative ways we like to think, which is based off of not just theory, but existing examples of youth and decision maker interface where we've seen active participation taking place from both sides, and at the same time we've also seen decision makers actioning out the feedback that they've received directly from young people. So what do we actually hope to do through this platform? We hope to institutionalize a platform wherein representatives of the larger 1 million cohort will get direct face time and will interface directly with decision makers from the ministry, specifically the Ministry of Health and Family Welfare. This is going to be how we envision it to be a regularized cadence, so it's not one-off, it's not tokenistic, and it's actually embedded within the existing systems and processes that exist within the ministry system. A key point for us when we were creating or ideating about this platform was the fact that if you're building platforms and pathways for young people to directly interface with their decision makers, it leads to a lot more effective and responsive interventions which are directly focused on the betterment and well-being of young people. So it's important to have young people obviously be capacitated for their agency and choice to be recognized, but at the same time for their voices to also be channeled directly to those who are sitting in offices where decisions about them are being made. Another objective of this entire platform was that when we create avenues and mechanisms wherein participation and perspectives from young people is being invited, it's very important for the feedback loop to also be completed, which basically means if young people and decision makers are speaking to one another, there needs to be a two-way accountability. Young people need to be accountable for the data and insights that they are bringing, but at the same time, decision makers need to be accountable that they're actually responding to what they're listening to, acknowledging the different and varied perspectives of young people, and at the same time, actioning out what they're hearing. These are just a few of also the learnings that we ourselves have got from working closely with the government, as well as different frameworks which focus on effective civic participation, specifically focused on youth participation. And it's also borrowing a lot from what we've seen from global partners such as Girls Not Brides, like Harshita mentioned, or even our own work working with adolescent girls who actually conducted a community level audit of existing healthcare services and then presented the gaps as well as the insights to their direct state level representatives. So in culmination, I do want to just circle it back before I hand over to Aditi. But the idea is to definitely hear from young people, give them, build their capacities which already exist, but also provide them opportunities to be heard at the same time. And that's how we envision this continuum of this entire initiative working out. I'll quickly hand over to Aditi to close out, but thank you.
Okay, I think this is on. Okay, thank you. I just wanted to quickly answer the question that you asked about some of the strategies. I think there are 2 or 3 things that we are kind of focusing on to make sure that it's actually regular. One is we're building what we're calling a quality of life task force. So we've begun engaging multiple stakeholders, so not just the health ministry, but also speaking to the youth affairs ministry, the education ministry, as well as other INGOs and leaders in the country who have spaces like ARC, etc., FP 2030, so that all of them are kind of directly involved in sort of the creation of this platform with young people as well. So it's sort of 2 parts of the sort of governance and accountability sort of mechanism. That's one. The second, like Ada said, is that we're pushing for it to be regular. So we are going in, we've already had one round of young people sharing data and insights with the government and then responding to it. But we're hoping to make it a regular forum so it doesn't just happen one time. And then the third thing which Ada talked about is bringing in data and insight regularly, right? Because one of the things that ends up happening is data can be a little bit outdated, and so it takes a long time for systems, etc., to recognize and act on them. And so we are doing regular youth-led sort of insight collection and taking those as assets that we then take into the government for them to be able to respond to those. That's a little bit of what we're doing. You can, we have cards here where you can scan and look at some of the work that we as Dasra do generally with young people, as well as what Youth Kebol is doing. You can follow us on Josh. You can also follow us on Twitter. We're at Youth Kebol. One of the things that I'd hope for everyone to sort of follow along on and collaborate on is we are launching the first of our campaigns in December, like Sharan mentioned, that's going to be focused on bringing in men into the conversation, talking about masculinity, talking about men and sexuality, their role in sort of contraceptive access as well. And we'd love for your networks to participate, for young male advocates in your networks to actually share their stories and share their perspective on how they are sort of male champions and allies when it comes to the conversation on contraceptive access. But thank you so much for your time. We're sticking around outside and we'd love to chat with you, answer any questions, hear your perspectives as well. But thank you so much.
If it goes, if you don't say it, there's a lot of your conduct.
I think there's a way because Zia just messaged saying you can say that. So I asked her, but I don't think so.
Letting know